Good afternoon and welcome to On Life Health's webinar series. I'm your host, Michael Detner, and today's topic is 3 Steps to Better Blood Pressure with Diana Kendrick. Diana, our presenter today, serves as the clinical specialist for chronic conditions here at On Life. She's been with us since 2008. She is a registered nurse with over 30 years experience. Welcome, Diana.
Hello and welcome. During this webinar, you'll be learning about 3 ways you can take charge of your blood pressure management. As we get started, you might want to grab a piece of paper and a pencil. There are at least a few bits of information that I do think that you'll want to jot down. The 3 steps to better blood pressure are working with your doctor, monitoring your blood pressure at home, and making lifestyle modifications. The first step, partnering with your healthcare professional, includes things like seeking regular medical care, taking your medications as prescribed, and following home monitoring guidelines. Let's take a look at each. Regular medical care is important for anyone, but it's even more important for people that have chronic conditions like diabetes or asthma or high blood pressure or hypertension. During appointments, you and your doctor should be putting your heads together to evaluate your treatment regimen. I know he or she is the healthcare professional, but you're the one that provides the out-of-office blood pressure readings, you report medication side effects, and ask important questions. Effective medical care just can't happen without your active participation. How often do you need to see your doctor? Well, routine office follow-ups for blood pressure management are often scheduled at 3 to 6 month intervals. But when you're first diagnosed or if your treatment plan changes, monthly checkups aren't uncommon just until you get your blood pressure back under control. Routine eye care is also important for people that have high blood pressure and those at risk for developing high blood pressure. The eyes are among the organs especially vulnerable to untreated high blood pressure. Other organs include the brain, heart, and kidneys. Another aspect of actively working with your doctor is asking what your treatment goal is. And there are 2 reasons for this. The first reason is that the latest guidelines from the American Heart Association and the American College of Cardiology now recommend different treatment goals based on age. A treatment goal of less than 140 over less than 90 is recommended for younger adults, those less than 60 years of age. Now, the recommendations are less stringent for adults that are 60 and older. For them, the treatment goal is to maintain a blood pressure less than 150 over less than 90. Adults 60 and older also might not be treated with medication until their blood pressure gets to 150 over 90. However, chances are really good that they'll at least be encouraged to make healthy lifestyle changes. The second reason that it's important that you ask your healthcare professional about your treatment goal is because, well, sometimes doctors miss chances to manage blood pressure. In other words, they're human. In the fall of 2012, results of a survey were published that showed that among patients whose high blood pressure was not controlled, only about 20% of office visits yielded a new prescription for blood pressure medicine. That number, however, jumped to about 40% when patients told their doctors that they were visiting to discuss their high blood pressure. Now, by no means am I suggesting that every patient whose blood pressure is not well controlled needs a new prescription. I'm just saying that telling your doctor that you want to discuss your blood pressure might be an easy way to achieve better blood pressure control. Not everyone who's on blood pressure medication takes it as prescribed. In fact, up to half the people on blood pressure meds may not be taking their medications as prescribed. Now, if you have a prescription for pain or itching, for example, you're very likely to remember to take the medication. But high blood pressure is a silent disease. There are no symptoms to remind you to take your medicine, even if your blood pressure is soaring. The worse your blood pressure control, the greater your risk for complications. So taking your meds as prescribed is a very important part of having an active partnership with your doctor. If you simply forget to take your meds, one of the things that you can do is to set up text messaging reminders And you can do that on the On Life Health website. and you might want to jot this down. It's at www.onlifehealth.com. And just click on the My Settings link at the top right of the screen to get started. And there are also, if you're forgetting to take your medications, special pill boxes, the little plastic ones that have the compartments with the days of the week, for example. You can set alarms to help you follow your medication regimen. And some patients find that what works for them is queuing their medications to daily events like meal times or bedtimes, and this is one of my favorites, or even putting on antiperspirant. So if you're not taking your medications as prescribed, talk to your doctor about it, especially if you're bothered by side effects. In addition to seeking regular medical care, discussing your blood pressure treatment, and taking your medications as prescribed, another important part of working with your doctor is following your monitoring prescription. Your monitoring prescription will depend on a number of things, including how well your blood pressure is being managed, and if your treatment plan has changed. If you don't have a monitoring prescription, or you don't know how often you should be monitoring at home, just call your doctor's office and ask. Now, of course, checking your blood pressure at home isn't going to be helpful unless, of course, you record your readings and share them with your doctor. And the OnLife Health website also has a blood pressure tracker where you can log your blood pressure readings paperlessly, and you also won't lose them, and then you can print them out to take to your doctor's appointments. This concludes the first step to better blood pressure, working with your doctor. Now, let's look at the second step you can take to improve your blood pressure management. Monitoring your blood pressure at home provides important information about your treatment plan, so it makes sense that your readings have to be as accurate as possible. I mean, your doctor is making medical decisions in part on the readings that you report. So having the right equipment, properly calibrated, and using the proper technique can help both you and your doctor feel confident that your blood pressure readings are as accurate as possible. Let's consider the blood pressure monitor. There are various types of blood pressure monitors for home use. There are wrist monitors. There are monitors that have upper arm cuffs that have to be inflated by squeezing a bulb. There are also some monitors that are semi-automated. The kind that's preferred is a fully automated digital monitor with a cuff that goes around your upper arm. And when I say fully automated, what I mean is that you put on the cuff, you push a button, it inflates the cuff, deflates the cuff, and provides you with a number on the screen. Monitors like these combine accuracy and ease of use. Now, if you need a new monitor, you could purchase one at some of the large discount stores. You can also purchase them at drugstores. And they vary. They have all kinds of features, all kinds of bells and whistles. Some include things like irregular heartbeat detectors, and some of them will tell you if your blood pressure is in the high range. There are monitors also that can store readings for you. They can even store readings for multiple users. And with the advent of smartphone apps, there are even wireless blood pressure monitors that have been developed that will work with smartphone apps. So there are a lot of different options available. You just want to make sure that it's fully automated, digital, with a cuff that goes around your upper arm. Cuff size is another important aspect of ensuring that your blood pressure readings are accurate. If you use a blood pressure cuff that's too small, you may get an artificially high reading. And the opposite is also true. A cuff that's too big can provide a reading that's artificially low. To verify that your cuff size is the right size, have somebody help you measure your upper arm at its midpoint. If your arm measures 9 to 13 inches, you should probably be using the standard adult cuff. Otherwise, you'll need to get a larger or smaller cuff. Some blood pressure cuffs actually have markings on them that will tell you whether the cuff is the right size for your arm or not. And there are also monitors that you can purchase that come with more than one cuff size. Now, if you find that you need a different cuff size than what you have, you can usually purchase a cuff separately and swap it out using the same monitor. And that's a really nice option, especially if you're in a household where you have multiple users and you need different size cuffs. The chart that's on your screen is just a guideline. Make sure that if you have any product-specific information, and I hope that you do, that you read it over very carefully. Calibration is another important aspect of home blood pressure monitoring that can help you and your doctor both feel confident that your monitor is accurately measuring your blood pressure. And calibrating just means that the accuracy of your monitor is measured against the accuracy of the blood pressure monitoring equipment in your doctor's office. And that's something that you should do whenever you buy a new monitor and then every year thereafter. A couple options that you have, one of them is you can just bring your monitor in when you go to your next appointment. Another option is you can just call the doctor's office to find out when you can bring your monitor in to have it calibrated. It's not something that usually requires an appointment. When you bring in your monitor, what they'll do is they'll check your blood pressure with your monitor, and then they'll check your blood pressure with the office equipment. And although the readings probably aren't going to be identical, they want to make sure that they're very close. I mean, as I said, your doctor is making treatment decisions based in part on those readings. Accurate, reliable blood pressures don't just rely on having a calibrated monitor of the preferred type with the right cuff size. It's not just a matter of having the right equipment. You have to use it right. So let me offer some tips for obtaining the most accurate blood pressure readings. First, don't check your blood pressure within 30 minutes of eating a meal, consuming alcohol or caffeine, or using tobacco. These are all things that can influence your blood pressure. Second, empty your bladder. Third, sit comfortably with your feet uncrossed. A lot of people tend to forget that one. Uncrossed and your back supported. And then rest for a few minutes. What I usually recommend is putting the cuff on and then just resting for a few minutes before pushing the button. Take slow, deep breaths or think of something that makes you smile. You want to be relaxed during the monitoring. For more important tips, I want to recommend this article, and this is just one of the pages. It's a 4-page article. It's available on the OnLife Health website that I gave you earlier. If you just click on the Health Information tab or do a keyword search for blood pressure monitoring, you'll be able to find it. I did make a point of adding the title to the slide. It's blood pressure : blood pressure monitoring. Make sure you get that title exact so that you can get the most up-to-date version of this article. We just finished the second of 3 steps to better blood pressure. The third step is lifestyle changes or modifications. Lifestyle modifications are foundational for the prevention and treatment of high blood pressure. Studies show that they can reduce blood pressure as much as some blood pressure medicines. In fact, they're often the first recommendation before medications are prescribed. And then, if and when medications are necessary, they're prescribed in addition to lifestyle modifications, not instead of lifestyle modifications. My intention here is only to briefly introduce the lifestyle modifications. There will be other webinars that will address some of the most important lifestyle choices in detail. If you are overweight, losing weight is the most effective way to improve your blood pressure. Very roughly, for about every 20 pounds of weight loss, the systolic blood pressure, that's the top number, comes down between 5 and 20 points. If you have a lot of weight to lose, don't be discouraged. Losing just even 10 pounds can start having a positive effect on your blood pressure. The DASH eating plan. The DASH eating plan is a healthy eating plan that anyone can adopt. DASH stands for Dietary Approaches to Stop Hypertension. And adopting the DASH eating plan can lower your systolic blood pressure by up to 14 points in just 2 weeks. It's also good for your blood pressure, it's also good for your cholesterol, and it can lower your risk for developing type 2 diabetes. For 4 years in a row, DASH has been voted the best overall diet by a panel of health experts that were assembled by U.S. News and World Report. You can use it to maintain your weight, or you can also use it to lose weight. This eating pattern emphasizes fruits, vegetables, and low-fat dairy. These food groups provide important nutrients to promote a healthy blood pressure, and it's interesting because they also contain nutrients that blunt the blood pressure raising effect of sodium. So it's kind of a perfect storm of nutrition. DASH is also low, as you can imagine, in unhealthy saturated fat. It's low in added sugars, and it includes healthy choices like whole grains and smart protein and fat choices. And you'll learn more about those in the DASH webinar. You don't necessarily hear a lot about weight loss or DASH for improving blood pressure. At least that's been my experience. But I feel like it's just the opposite with sodium. There's a lot of attention focused on cutting sodium intake to improve blood pressure. Limiting your sodium intake to 1,500 milligrams a day, and that's the recommendation for the dietary guidelines for Americans, can reduce your systolic blood pressure, again that's the top number, by up to 8 points. However, it can be challenging to do, and it doesn't taste very good. Rather than tracking sodium, I prefer a much more practical approach. It's also an approach that is adopted by the latest guidelines, and it's just more general, and that's just to reduce your sodium intake. The fact is that only a small amount of sodium occurs naturally in foods. About 75% of the sodium that we take in comes from restaurant and processed foods like soups and condiments and canned foods, things like prepared mixes too. So based on this information, let me offer a few ideas. First, prepare your own food whenever you can. Eat out less. Next, choose less processed foods. Compare nutrition facts labels and choose foods that are lower in sodium. For example, you want to buy a loaf of bread, pick up several brands of bread, compare their nutrition facts labels so that you can make smarter choices. And then also there are plenty of foods that are labeled low or reduced sodium, no salt added, light in sodium, etc. So those tend to be better choices as well. Most people find that taking a gradual approach is best. That lets your taste buds adapt, and the taste for saltiness is an acquired taste, so you really will adapt. Your taste buds really will adapt to that. Regular aerobic physical activity is recommended for improving blood pressure. It can reduce your systolic blood pressure by up to 9 points. What you want to aim for is at least 3 to 4 sessions a week that average about 40 minutes each. One of the really cool things about aerobic exercise is that its blood pressure lowering effect is immediate. That's very cool. Moderate intensity activity is what's generally recommended. If you want to do a vigorous intensity aerobic activity, and just to kind of give you an example, moderate intensity physical activity would be something like brisk walking. Vigorous intensity would be more like jogging or running. So if you want to do vigorous intensity, or you want to start a strength training program like lifting weights, for example, you want to make sure that you're getting medical clearance. It's a big safety issue, especially if your blood pressure isn't well controlled or if you have other health risks. And during our third webinar, you'll be learning more about physical activity to improve blood pressure. If you drink too much too often, reducing your alcohol intake can help lower your systolic blood pressure by up to 4 points. Now, alcohol recommendations differ based on your sex. Women should limit themselves to 1 drink per day, and men should limit themselves to 2 drinks per day. Sorry, ladies, our bodies are just more vulnerable to the ill effects of alcohol than men's bodies. Now, it's important that you know what counts as 1 drink, and it's probably not one of those punch bowl sized drinks with the little umbrellas. 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of hard liquor, each equal 1 serving of alcohol. If you need to lose weight, drinking alcohol will help. Drinking less alcohol will help. Less alcohol means fewer calories. It's kind of cool how these healthy lifestyle choices have synergy. Adopting DASH can help you limit your sodium. Adopting DASH and exercising regularly can help you lose weight. Limiting your portion sizes to lose weight means less sodium, etc. It's neat. They all fit together. Limiting alcohol is the last of the lifestyle changes. I realize that this has been a tremendous amount of information, so what I'd like to do is I'd like to give you some real specific action steps just to get you started. The first one is to schedule your next medical appointments, and that includes eye care. Do that as soon as possible, especially if it's been a long time since you've seen your doctor about your blood pressure. Remember to tell your doctor that you want to talk about your blood pressure and find out what your treatment goals. We should know what is expected when we're under medical treatment. Next, you want to make sure that you have the right equipment for home blood pressure monitoring, and that includes the right monitor and the right size cuff, and make sure that you have your monitor calibrated. And then last, but definitely not least, if you'll go to the OnLife Health website, I'd really like to recommend the Blood Pressure Self-Directed course. It's one of the On My Time courses. It'll reinforce a lot of the information that we've covered, and it'll also provide you with the practical assistance that you need in adopting healthy lifestyle choices. These are the upcoming webinars. The next webinar will be on the DASH eating plan, and it'll include specific and practical information and resources to help you adopt DASH. And then the third webinar in the series addresses physical activity, and the final webinar will address chronic conditions that commonly coexist with high blood pressure. I think we have time for a few questions.
We do have some questions, Diana. First of all, thank you for some very interesting and very important information there. The first question is, what is a normal blood pressure, and what, by contrast, is a hypertensive crisis?
Okay. A normal blood pressure is a blood pressure less than 120 over less than 80, and it has to be both numbers to be considered a normal blood pressure. High blood pressure starts at 140, that's the top number, over 90, and it can be either one of those numbers. You can have a number that's less than 140, but if you've got a bottom number, a diastolic blood pressure that's 90 or higher, that would be considered the beginning of hypertension. And then in between, a top number of systolic blood pressure of 120 over 139, or having a bottom number 80 to 89, that would be considered what we call pre-hypertension, and that means that you're at greater risk for developing hypertension. Doesn't mean that you have it, it just means that you're at greater risk. If you have a number that falls into two different stages, what they'll do is they will use the higher stage to classify your blood pressure range. And I'm really glad that you asked about hypertensive crisis. If you have high blood pressure, you want to know at what point in time you should receive emergency medical care. Hypertensive crisis is when you have a blood pressure of 180 or greater, or a bottom number, a systolic blood pressure of 110 or greater. If you have a blood pressure that's in that range, what you want to do is you want to double check that you're checking your blood pressure in the most accurate way using the proper technique, and you want to rest for a few minutes and breathe, and then recheck it. So after about 2 or 3 minutes, if you recheck it and it's still in that range, it's very important that you seek immediate medical assistance. A blood pressure that's that high can actually cause damage to organs, so it is an emergency.
Good to know. Diana, where can I learn more about DASH?
I'm so glad that somebody asked that question, because I just think that the DASH eating plan is awesome. And I hate the thought of somebody just waiting till the next webinar to start making some healthy changes in their diet. If you go to www.dashdietoregon.org, and I'll spell that out for you, DASHDIETOREGON.org. It's a great website. It's all things DASH with really practical resources. They can recommend books. They have shopping lists. They have DASH trackers. They have the latest information on DASH research. So I just think it's tremendous. So I would refer anybody immediately to this website. You can also go to the American Heart Association website, and then believe it or not, the American Diabetes Association website to get more information on not only about blood pressure, but also about making healthy eating choices.
Very good. And finally, what is the difference between salt and sodium, or are they the same?
Okay. They are not the same, although I find that in a lot of common literature they're used interchangeably. And if you're a precise person, it may annoy you. But they're not the same. When you look on nutrition facts labels, they're never going to say salt. You're going to find a number of milligrams of sodium. But salt is sodium chloride. That's the chemical name of salt, is sodium chloride. And it's about 40% sodium. So if you are consuming, using the salt shaker a lot, you are probably consuming a lot of sodium as well. So a couple things I did want to add a few things about sodium. One of them is that even somebody that hasn't lost weight, if they reduce their sodium intake, we know that can improve somebody's blood pressure. That will drop somebody's blood pressure, which is what we want. And so I mentioned the number of milligrams a day. Some people find it helpful to have numbers, and the latest guidelines, in addition to just generically saying reduce sodium intake, that you can reduce your sodium to 2,400 milligrams a day. They found that was helpful. I already mentioned the 1,500 milligrams a day for an even greater reduction in blood pressure. And then just, if you're consuming a lot more sodium than that, just reducing your sodium by 1,000 milligrams a day or more. But again, that's if you're tracking your sodium intake. I would still be much more strong advocate for that practical approach of preparing your own meals, etc.
So just because I'm not using the salt shaker doesn't mean I'm not getting more sodium than is good for me.
Exactly. That's exactly what I want people to know, that it's more about those restaurant and processed foods than the actual salt shaker.
Right. Well, it appears that our time is running short. Thank you, Diana, again for your wisdom and expertise. And thanks to all of you for taking the time to join us today for this webinar. For On Life Health, this is Michael Detner. Have a great day.